concern about the efficacy in the real world of vaccines, I hope we've put that to rest. Next slide. So what do we have? We have 62 million Americans eligible for vaccines who are still not vaccinated. The data that I show you do not lie. Vaccines protect you, your family, and your community. And importantly, it is not too late, as Dr. Walensky has said. Get vaccinated now. And importantly, if you are already vaccinated 6 months or more ago and eligible for a boost, get a boost, because as a matter of fact, the data that I just showed you for vaccinations in general hold true for boosters, because the Israelis have shown that when you boost, you multifold diminish the likelihood of getting infected, getting sick, or dying. And a recent paper from England, it isn't only Israel, shows for those who got the Pfizer vaccine months earlier, and the efficacy against symptomatic infection decreased to 62.5%. With a boost, it went up to 94%. So vaccinations work, and boosters optimize the vaccination. Having said that, let us all enjoy the holidays. Now over to you, Dr. Murthy.
Well, thanks so much, Dr. Fauci, and it's good to be with everyone again today. I want to speak a little bit today about misinformation and our efforts to fight misinformation. Just a few months ago, my office released the Surgeon General's advisory on health misinformation, which is false, inaccurate, or misleading information according to the best evidence at the time. Now, in this advisory, we declared that health misinformation is an urgent public health threat. Since then, I've been inspired by people all over the country who have stepped up to confront misinformation. I've heard from doctors and nurses and pharmacists who have talked to their local schools about vaccines. I've heard from local elected officials who are making health misinformation a priority. Just a couple of weeks ago, I joined hundreds of people of faith who gathered virtually to hear the truth about the COVID-19 vaccines and to share that with their communities. So we are continuing to meet people where they are today. And today we're also happy to welcome the singer and philanthropist Sierra to the White House, where she will participate in a roundtable about getting vaccinated with First Lady, Dr. Jill Biden. These are just a few of the many encouraging steps that we've seen over the last few months. But despite all of that, health misinformation remains a threat today. With new milestones like vaccines for kids ages 5 through 11, we're seeing new waves of misinformation hitting the inboxes of parents and social media feeds across the country. This isn't just something that affects a small segment of society. A recent poll indicated that nearly 80% of American adults either believe or aren't sure about a common COVID-19 myth. As clinicians, community leaders, and other partners tell me as well, they are continuing to hear people quoting these myths to explain why they won't get vaccinated. I've even heard some of these myths from my own family members who have received misleading videos and false articles through text chains and social media feeds. And I've had to talk to my family members about why this content is harmful. But while it's clear that stopping misinformation is an urgent task, we recognize it's not always clear to people what they can do to help. And that's why last week, I released a community toolkit for addressing health misinformation. This toolkit is meant for everyone, from healthcare professionals to teachers to librarians to faith leaders, and really anyone who's concerned about health misinformation in their community. We have two key goals with this toolkit. The first is for people to learn about health misinformation. So the toolkit includes the basics about what it is, how it's impacting us, and why it's so tempting to share. The second goal of the toolkit is for people to apply what they learn. And that's why we've included interactive activities in the toolkit. There are graphics, checklists, 5-minute exercises, even a comic strip. And we've included tips on how to identify misinformation and how to talk with friends and family about health misinformation. This is something, in fact, which might come in handy around the dinner table this Thanksgiving. The toolkit is easy to read. It's illustrated. It's designed to give people the power to stop health misinformation in their communities. You can view the advisory and the toolkit at surgeongeneral.gov/health misinformation. I also want to be clear that our country still needs technology companies to step up and stop the avalanche of health misinformation on their platforms. In order to fully turn the tide on health misinformation, we not only need individual action, but we also need these companies to move faster and more effectively than they are currently moving. In the end, we all have the power to protect people in our lives from health misinformation. Whether we're able to reach just a few trusted family members and friends or a few million people through our platform, we can all make an impact on this urgent issue. Because the bottom line is that health misinformation takes away our freedom to make informed decisions about our health based on facts and science. This toolkit is one more step we are taking to help Americans recognize and stop health misinformation and to help people around them do the same. It will help us restore our freedom to make decisions about our health that are grounded in accurate science-based information. Thanks so much for your time today, and I'll turn it back to you, Jeff.
Well, thank you, doctors. Let's open it up for a few questions. Kevin?
Thanks, Jeff. First question, let's go to Kristen Welker at NBC.
Hi, everyone. Thanks so much for doing the call. Really appreciate it. Two questions. One, can you bring us up to date on any data that you might have about breakthrough cases with kids? And number two, can you weigh in on or reflect upon the fact that you have some areas that are lifting mask mandates and others that are reinforcing them? For example, DC is set to lift its mask mandate indoors, whereas you have other areas in the region that are set to reimpose them. What should we make of that? And should there be a uniformity as it relates to masks?
Okay, Dr. Walensky, first question was data on breakthrough with kids.
Yeah, thank you for those questions, Kristen. So we are actively following vaccine effectiveness in our adolescents, our age 12 and up, where we have more data, and we'll be updating our data on vaccine effectiveness later this week. In the meantime, we are actively also following data on our 5 to 11-year-olds. Obviously, we need some time for them to get their first dose, get their second dose in order to follow those breakthrough cases, but we are actively collecting those data.
Dr. Walensky, there is strong data that I think the CDC has cited about hospitalizations of kids that are vaccinated versus unvaccinated. Is it worth reviewing that data?
In terms of, certainly in terms of our adolescents?
Yes.
Yeah, so certainly the protection from our adolescents, as we've seen, is more than tenfold prevention of hospitalizations and deaths among our adolescent group. And we expect that same kind of extremely robust coverage for our younger group as well.
Then the second question was the masking mandates.
Yeah, absolutely. So we currently still have over 85% of our counties in this country that are in substantial or high transmission. And the CDC guidance, first of all, obviously getting vaccinated, but the CDC guidance does recommend that jurisdictions be in the moderate or low transmission, community transmission for several weeks before releasing mask requirements.
Next question.
Go to Victoria Knight at Kaiser Health News.
Hey, thanks so much for taking my question. I actually have two. So first of all, I've talked to experts. I've looked at the data myself. I don't see a lot of evidence to support giving a booster for young people, mostly in the 18 to 39 age range, because there's just like not a lot of evidence that it protects from severe disease or hospitalization. It seems like that group of people is already pretty well protected. So can you talk about what evidence we might see if the FDA does decide to authorize a third booster for everyone? And then I'm also wondering if boosters do get authorized for everyone, are we moving to kind of a post-full vax society? Are workplaces, are businesses going to need to ask for proof of boosters? Is that the direction that we're moving in if we do decide that the whole public needs boosters?
Good. Dr. Fauci, why don't you start with the evidence around younger people and boosters?
Yeah, I think we better be careful to not make too sharp a distinction between protecting against infection that's symptomatic versus protection against hospitalization and deaths. Obviously, young individuals have a much less of a likelihood of progressing to severe disease than elderly individuals and adults. However, the children do get infected and they do get mild and sometimes moderate illness. So I don't know of any other vaccine that we only worry about keeping people out of the hospital. I think an important thing is to prevent people from getting symptomatic disease. And I think there are plenty of children, adolescents and otherwise, who clearly get infected, get symptomatic disease, and some even go on to long COVID. So there's a really good reason to optimally protect younger individuals, in addition to obviously emphasizing the very strong importance of making sure that more vulnerable people, namely the elderly and those with underlying conditions, not only get their vaccination, but also get their booster. Back to you, Jeff.
Dr. Walensky, the second question was really the definition of fully vaccinated.
Yeah, great, thank you. So the definition of fully vaccinated is 2 doses of a Moderna or a Pfizer vaccine, as well as 1 dose of a J&J vaccine. Thank you.
Next question.
Miller, AP.
Thanks for doing this. Just from the 30,000 foot level, as a number of public health officials across the country and around the world are saying that COVID-19 is becoming endemic, what is now the U.S. government's goal? What is the objective now in controlling the COVID-19 pandemic? Is it, stamping it out entirely? Is it coming up with a way for the country to live with it going forward? And then secondly, given the data that Dr. Fauci showed about the effectiveness of vaccines at preventing serious illness and death, how much longer will the public health protection measures that Dr. Walensky was talking about along the lines of masking and the like, how long should those stay in place for when vaccines are now widely available for 90% of the country's population?
Dr. Fauci?
Well, when you look at any kind of an outbreak, as I've said multiple times, but I'll very briefly repeat it, there's the pandemic phase, the deceleration phase, control, elimination, and eradication. I don't think we're going to get eradication. We've only done that with smallpox. We've eliminated diseases by vaccination like polio in the United States as it exists other places. We've eliminated measles in the United States. It exists other places. We've eliminated malaria years and years ago, but it exists in other places. So I don't think we're going to eliminate it completely. We want control. And I think the confusion is, at what level of control are you going to accept it in its endemicity? And as far as we're concerned, we don't know really what that number is, but we will know it when we get there. It certainly is far, far lower than 80,000 new infections per day, and is far, far lower than 1,000 deaths per day and tens of thousands of hospitalizations. So even though there's a wide bracket under control, we want to get to the lowest possible level than we can get. And rather than picking an arbitrary number, why don't we get as many people as we can get vaccinated as quickly as possible, and get as many people who are eligible for getting boosted as possible. And then when we get to that low level, we will know it rather than picking out an arbitrary number. Back to you, Jeff.
Thank you. Thanks, Dr. Fauci. Next question.
Go to Alex Alper at Reuters.
Alex? I'm going to try someone else.
Alex.
Can you hear me?
Now we can. Yes, thanks.
Thank you so much. I just wanted to ask, the funds for the $1 billion in extra doses are only going to the mRNA vaccine makers. That list only includes Pfizer, BioNTech, and Moderna, or are there others? Why are you limiting it as such?
Well, we do want to create the capability to have 1 billion doses of mRNA vaccine produced. That's incremental capacity to what we have today, where the first application is likely to be used to produce more COVID-19 vaccines for the world. And then we have this ability for any future threat to produce mRNA vaccines to counter that threat. The companies that you mentioned are companies that currently produce mRNA vaccine, but there are also other companies that are subcontractors of those companies. So we envision a wide array of companies responding to HHS's request for information. Next question.
Last question. Let's go to Cheyenne Haslett at ABC News.
Hi, thanks for taking my question. My first question is on boosters. J&J boosters are already recommended for all adults. Pfizer boosters for all adults are expected by Friday to be authorized. Will the FDA consider Moderna in this upcoming authorization too? And my second question is on the confusing patchwork of booster recommendations in different states this past week. And I'm wondering why have the CDC and FDA not spoken out to give uniformed guidance as that has happened? Thank you.
Dr. Walensky?
Yeah, thank you for that question, Cheyenne. And maybe I'll just answer them all together and say we are actively following the science and the data. We know now that tens of millions of Americans are eligible for boosters, and we are encouraging everyone who is eligible, and especially those who are most vulnerable, those over the age of 65, those with underlying medical conditions, to go and get your booster right now. And as you noted, the FDA is actively reviewing data and we are in close touch with them. As soon as the FDA reviews those data and provides an authorization, we at CDC will act swiftly. We will be reviewing the epidemiologic data, the effectiveness data, as well as the safety data, and we will provide our recommendations as soon as we can.
Well, thank you for today's briefing. We look forward to the next one. Thank you, everybody.